Welcome, folks. Welcome to another edition of EMT adjuncts. Today, I'm going to talk about the pocket mask. These are good to have in your backpack or your first aid kit. It's not bulky in case you need to do CPR or mouth-to-mouth resuscitation. Um, it has the one-way valve and it has a filter inside. And this way, if emesis or vomiting won't come up, there's also a port where you can put the oxygen tank on there. So, oxygen tubing. So, just the pocket masks, different companies. This one's from Boundtree. I know different companies, American Heart, and other companies sell them. So, they're good to have. One of the other things that you'll be using in the EMT program is your bag valve mask, also known as BVM. Years ago, there was a company called Ambu bags. We used to call them Ambu bags, but basically, the mask goes on, and usually the mask, the narrow part goes over the nose, and the wider part goes over the mouth. This should be slightly inflated so that it gets a good seal. If it's flat, may need to inflate it or get a different mask. There's like a pop-up valve just in case you give too much pressure. And then you have the reservoir bag. The reservoir bag fills up with oxygen and delivers the extra amount of oxygen. And then you have your oxygen tubing. Uh, don't forget to connect if you have oxygen, because otherwise you're only given 21% of oxygen with this versus 100% if you're using the bag valve mask with an OPA airway or a nasal that will later. But um, basically, you want to make sure that you inflate just enough for the chest to get a good seal. I use the C method, the C clamp. Uh, and then with these fingers, you can pull back on the head tilt chin lift. And if you develop ever choppy respirations like that, you'll get stomach in the air and you'll get regurgitation and abdominal distension and stuff like that. So you got to be careful. Um, 15 liters per minute for oxygen. If you have a lot of the big giant tank, you go 25, but the smaller tanks, you're going to run out faster. So be cognizant of that. If you're, going from the high rise or, distance away to the ambulance or to, make sure that you're not going to run out of oxygen. If not, have two tanks with you. But so that's the bag valve mask, BVM. This is it right here. This is one of the main things. Uh, the pulse oximeter, and everyone should have this one besides, at the house, but you should also carry one in your kit. And this is one of the things that they use a lot in the hospital and pre-hospital setting, and basically it has the infrared light inside. Put the middle finger in or the thumb, and what it does is it sends a beam through your nail bed and calculates and comes out with the percentage of how much oxygen you have in your bloodstream, the hemoglobin. And so, like right now, it's like 61 with the setting at 98%. You see that? If what happens if you have nail polish? Sometimes you can turn it sideways like this, and get a reading that way. Um, Sometimes if you have to go on the toe, on the foot, or nail polish removal, or something like that. So that sometimes that could be kind of tricky. If it's cold, uh, it may alter the reading because of cold or poor circulation. And then also to make sure that you wipe it off after each use with just some gentle solution, water, hand sanitizer, something like that. Uh, Try not to damage it. And so that's your pulse ox, probably about 50 bucks at your local drugstore. but this will give you an indication how much oxygen you're getting. Now, you should never treat just the equipment. A person could have a good SAP, but something else could be wrong, or just use this as one of your tools to you know give good care to the patient. But a good physical, a good head to toe sample, good history will go a long way. So those are a couple of the adjuncts that I wanted to show you. Another one is the blood pressure cuff. Now this is not your manual one. This is goes to an automated machine, but I just wanted to kind of go over placing the blood pressure cuff. Now, the problem with the manual blood pressure cuff that they use a lot is that sometimes it could be off. If it's not calibrated right. Was it dropped or something like that? So, but the way you want to do it is you want to get the blood pressure cuff just about the above the AC, the anacubital area, with where the bladder is going to fill up, going to your artery here. There's an artery here. Okay, and once you feel that, you got this over there, and you can slip two fingers underneath without it slipping off. Then what you want to do is position the arm at heart level. Now, I remember going to a lot of calls, and the arm would be down, and they would take the blood pressure, and it was consistently high, 210 or 120. I started saying, "Hey, wait a minute, if you go like that, it's going to be low, but get it nice and heart level, palm up, relax your arm." And sit down. If you can take your blood pressure, sit down for a few minutes, 5 minutes, take some deep breaths, relax. And then with your feet on the ground, uncrossed, and take your blood pressure. If you're doing an automated one, if you're doing an auscultated one, which is I recommend out in the field, do an auscultated one, is you get the stethoscope, you pump it up. As you're listening, the first sound that you hear, the poop, 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 that's your systolic, the heart's contracting. And then you keep opening it up. And then when it disappears or it changes to a lesser tone, then that's your diastolic. A lot of times it disappears, but sometimes you'll hear it all the way down. So where is it? Well, when it goes from boom, 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 then that change, that's where your diastolic is. Now, the diastolic is when dying out, when your heart is filling, when it's the rest state. The systole is when it's contracting. So, now the American Heart Association, they changed the criteria. You don't want a blood pressure, over 120 over 80 or something like that. So you want to maintain a lower blood pressure because, obviously later on, damage to the arteries, high blood pressure causes, kidney disease or, cardiovascular disease. For today, God bless every safe out there. Support one another. Stressful times. A lot of stress going on, especially for our healthcare professionals. Going out there and meeting the challenge, saving lives every day, and there's other different first responders, pharmaceutical ones. Your technicians at the hospital, your lab techs, your OR techs and stuff like that. So give them praise to all the firefighters, they risk their lives, and the EMTs and paramedics risk their lives every day to go out and make a difference. So, as a upcoming EMT or starting out and want to become a firefighter, it's a great career, helping folks. It's an honor and privilege to serve the citizens in that capacity. I mean, there's no other rewarding career than being a firefighter or a first responder, a public servant, and just the badge, just the uniform opens up a lot of doors. Throughout the years in Oakland, I supported families that had lost loved ones through horrific accidents or violence or fires. And we did I did a lot of community interaction. critical incident stress management with them. I attended some funerals. I laughed and cried with the citizens out there of Oakland. I loved them all. I loved the work. Yeah, but I'm telling you that being a firefighter opened a lot of doors for me to go in and offer those services. There's one thing about being a firefighter and then working from 8 to 8 and then getting off and going home, but volunteering your time, being involved in the extra programs that benefit the community. It's what it's all about: customer service. Being involved in the programs that are that delivered to the citizens, to the kids. The toy program, random acts of kindness. Whether it's your communities of Oakland responding to emergencies corps, like your CERT team, just search and rescue, just different things really make a difference. So, anyway, everybody have a great day. Thank you very much for watching. This is Carlos Harvey out.